Post-traumatic headaches are very common in people who experienced a concussion or other brain injury. In this video, we're going to provide you with some effective ways to manage the symptoms and educate you on options for treatments for these types of headaches. We'll cover medication options, treatments we provide at our facility at Cognitive Effects, and some at-home remedies. Post-concussion headaches are complicated, and there's still so much work to be done in understanding why and how they happen. Some patients don't always respond to medication. Sometimes it takes other therapeutic interventions to bring them under control. Treating them is the key. The prevalence of headache in concussion patients is anywhere from 47 to 95%. These types of headaches often present themselves differently from other headaches. Now, there are 6 different types of common post-concussion headaches. We discuss these types of headaches in detail in another video, and you can click the link above or in the description below. But for this video, we're going to focus on how to manage headache symptoms regardless of the type. At Cognitive Effects, we treat post-traumatic headaches as well as many of the other common symptoms of concussion in patients whose symptoms persist for 3 months or more, at which point we would consider this post-concussion syndrome or PCS. At Cognitive Effects, we focus on treating the underlying cause of the headaches instead of just masking them with medication. You can experience a post-concussion headache years after the original injury. It might be constant the entire time, or it might come back months or years later. The length of a post-concussion headache is highly dependent on certain risk factors such as genetic predisposition, what type of brain dysfunction you're experiencing, and what types of post-concussion headaches you are getting. Most concussion symptoms, including headaches, typically resolve within 3 to 6 weeks. But if you are still experiencing what you think are post-concussion headaches beyond that period of time, then it is unlikely your headaches will resolve on their own. The length of a post-concussion headache can vary greatly from person to person. The best treatment for post-traumatic headaches is to treat the concussion itself rather than just medicate the pain. For example, ANS or autonomic nervous system headaches won't completely resolve until the autonomic nervous system is re-regulated. But this doesn't just happen with time, and it does not happen with medication. Many people will speak to their doctor about medication options, and these may temporarily help with symptoms, but usually don't effectively reduce all the headache pain. Furthermore, many of these medications have concerning side effects and even drug-to-drug interactions that have not been considered, which can actually make overall symptoms worse. In the first 48 hours, it's usually safe to take Tylenol or acetaminophen if you need pain relief. However, NSAIDs or non-steroidal anti-inflammatory drugs like Advil or Aleve could be dangerous if you have any bleeding in the brain after a concussion, which is why you should not take them until at least 48 hours have passed. They also might help more than Tylenol because they can decrease any remaining swelling or inflammation, as well as reduce muscle tension. While over-the-counter pain medication is okay to take for a few days, it's not a long-term solution. Even worse, prescription headache medications are not often helpful and can even perpetuate the headache. If you're experiencing a true migraine, then migraine medications might help. For example, some patients find that migraine medications provide some relief because it helps with the migraine, but also depression as well as sleep quality. Unfortunately, many of the patients we've treated have shared that these meds don't work, usually because they do not have true migraines. Rather, they have post-concussive headaches. Many patients have been prescribed beta blockers for their post-traumatic headaches, but again, these do not resolve the source of the issue, which is dysregulated autonomic nervous system and neurovascular coupling, and may come with undesirable side effects, even potentially leaving the patient susceptible to medication overuse and even a dependence. Many patients are referred to a neurologist for their persistent post-concussion headaches and other symptoms. These doctors may or may not have had training for post-concussion treatment and are likely to prescribe medication as a first line of defense rather than therapy. In summary, treating headaches with medication is not ideal because it does not solve the root issue. It might cause side effects. It could put additional strain on your liver, which may already be struggling due to autonomic nervous system dysfunction, and also may result in dependency. Here at CFX, we address the source of the headaches rather than just alleviating the pain. We provide our patients with therapy designed to promote neuroplasticity, which is the brain's ability to change and to heal itself and your body. Now, during treatment, our patients go through an intense therapy regimen designed to kickstart neuroplasticity. Therapy begins with cardiovascular exercise to improve blood flow in the brain and prepare the brain for cognitive exercise. Doing so boosts helpful neurochemicals such as BDNF, or brain-derived neurotrophic factor, that make therapy more effective. Patients then complete therapy to address neurovascular coupling dysfunction and accompanying cognitive deficits before resting and then repeating that cycle again. After cognitive exercise, the brain needs some time to recover to perform its best. The continual cycle of exposure to various exercises tailored for each individual helps disrupted pathways recover and improve neurovascular coupling. Here is a list of effective therapies patients receive during their time at CFX. Neuromuscular therapy, occupational therapy, vision therapy, vestibular therapy, cognitive therapy, sensory motor therapy, neurointegration therapy, psychotherapy if needed, and more. While treatment addresses physical and cognitive symptoms, over 70% of our patients report emotional symptoms too. Now, many of these symptoms resolve after treatment, but certain mental health conditions such as depression, anxiety, and PTSD, or post-traumatic stress disorder, need more time and treatment to resolve. The brain's ability to heal with our multimodal treatment program brings hope to our patients and to anyone else who has sustained a brain injury. Aside from treatments that you can undergo at our facility, there are simple steps that you can take at home to begin dealing with post-concussion headaches by reducing symptoms. One of the first things that we recommend is to avoid stimulants or depressants such as alcohol and caffeine. Just like other medications that can provide temporary relief, they can also exacerbate or make worse the underlying cause of your headaches. Now, for autonomic nervous system headaches, reducing stress is a very important part of any post-traumatic headache treatment plan. For example, you can practice mindfulness and mindful breathing daily, breathing in and out with a focus on your breath. Breathing in this manner helps decrease the sympathetic nervous system override and improve blood flow, along with many other benefits. Other stress reducers, such as using essential oils, can help alleviate headache pain and reduce frequency. Meditation and brainwave entrainment can also help calm a sympathetic nervous system override. Now, for persistent sinus pain and pressure, using a hot pad on the sinuses can help to open up the blood vessels and reduce pressure. And maybe adding a little bit of peppermint oil may also help to open up congestion and help with that relaxation. Now, with spine-related and cervicogenic headaches, simply stretching the neck or doing some physical therapy exercises can alleviate some of the muscle tension and pain. For vision headaches, completing vision therapy, practicing good screen hygiene, like keeping the screen far away from your eyes or using a blue light filter, putting screens away before bedtime, may reduce post-traumatic headaches. For post-traumatic headache treatment, it is important to stay healthy overall. Eat healthily, take supplements and vitamins as needed, stay active. Although exercise may immediately make your headache worse, consistent exercise can help to alleviate your headaches over time by improving your cardiovascular health and autonomic nervous system balance. But try exercising in intervals rather than all at once, and even take breaks as needed to keep your symptoms at a manageable level. Many of our patients will say that they benefit from mild aerobic activity, but weightlifting or other sorts more intense exercises can put pressure on vasculature and can cause an increase in symptoms. Finally, flavonoids have been shown to improve cardiovascular health and reduce headaches. Other supplements that boost overall health and decrease stress can help as well, but please consult your medical professional before starting and stopping supplements. If you've tried various at-home treatments, but your symptoms are still getting worse, then it's time to consult with a healthcare provider. If you have any of the symptoms of a severe traumatic brain injury, such as excessive drowsiness, in and out of consciousness, confusion, memory loss, extreme personality changes, slurred speech, and poor gross and fine motor coordination, please visit the nearest emergency department immediately. If you're experiencing persistent post-concussion symptoms and want to resolve their underlying cause, schedule a free consultation by clicking the link below to see if our treatment can help you. On average, our patients see a 75% improvement after treatment at our center specializing in neuroplasticity-driven therapy. Lastly, you can check out our online headache course, which covers the different types of headaches you can get after a mild traumatic brain injury, as well as specific techniques for coping with each of these types of headaches. Subscribe to the channel if you want additional information and training on how to deal with brain injury symptoms and PCS headaches. Good luck on your healing journey, and we are here to help in any way.